Hi, I am Dr. Vinoth Kumar, Interventional Cardiologist from Prathima Hospital. One important question nowadays many people are asking, will the COVID affect the heart also? Yes, of course. See, we know coronavirus enters the body through the mouth, nose and eyes, and it goes to the lungs and it damages the lungs. Secondary to that, entire organs of the body is affected. But all of us know that it is affecting lungs. But for the past 3 to 4 months, we have seen that significant number of deaths due to coronavirus is related to heart problems. Surprisingly, the coronavirus directly affects the heart or it causes clot formation. See, what happens is coronavirus enters the body and directly damages the heart muscle. Normally, heart pumping capacity will be around 50 to 70%. Heart will be pumping very fastly like this. But when the coronavirus affects the heart, the pumping slowly comes down. Sometimes it may be less than 20% also. So, heart is the only organ which supplies the entire body. When the coronavirus affects the heart, when the pumping capacity comes down to less than 25 to 30%, how can it supply to the entire heart? Heart itself cannot pump very forcibly. So, blood supply to the entire body is affected. This is the number one mechanism by which coronavirus is affecting the heart. Second is very dangerous one, that is this coronavirus forms clot formation in the blood vessels. That is, it damages the blood vessels, blood tubes of the body and causes clot formation in the blood tubes of the heart, blood tubes of the kidney, blood tubes of the brain and blood tubes of the legs. When the heart is affected, that is when the coronavirus is affecting the heart, it forms clot formation. Usually we have two blood vessels on the left side, one on the right side. When one of these blood vessels is affected by the coronavirus, when the clot formation happens, when it becomes 100%, that territory supplied by that blood vessel is 100% damaged. So even heart attack can happen due to coronavirus. See, the block can be due to any other reason. It can be normal persons, it will be cholesterol blocks. In coronavirus can affect a healthy person, a normal 35-year-old male patient, very young male, no problem, non-smoking, non-diabetic, no risk factors are there. If that patient develops coronavirus, there is a chance that this coronavirus can cause clot formation in the heart and can cause heart attack. Sometimes this coronavirus can cause clot formation in the legs. That clot formation which is there in the legs can travel to the lungs and can cause sudden cardiac death. So always be careful. The coronavirus not only affects the lungs, it can affect the heart also. So whenever you have chest pain or breathing trouble, you should be very cautious. Whatever the reason may be, whenever you are suffering with chest pain, you should immediately go to the hospital. See, normally 80 to 85% of the patient with coronavirus have only mild symptoms like fever, cough, sore throat, body pains, sometimes loss of smell, loss of taste, all those minor complaints. Majority of those people can be managed very well at the house. But if you develop a symptoms like chest pain may be like burning sensation or heaviness or tightness, maybe sometime left hand pain might be there, or breathing trouble. See, previously normal person developing breathing trouble, or if you are walking 10 meters also if you are feeling breathing trouble, or if you are at rest if you are feeling breathing trouble, that means you should be careful. You should immediately visit the hospital. Any chest pain, any breathing trouble during this COVID time, please don't ignore. Immediately go to the hospital. They will take necessary investigation like ECG, echocardiography and some blood test, and they will see whether heart attack has happened or not. If at all, if heart attack is there, golden hour is only up to 12 hours. So the treatment is beneficial only up to 12 hours. In that, only up to 3 to 6 hours you will get maximum benefit. Next 6 hours you will get less benefit only. For example, a person goes to the hospital at 3rd hour of chest pain. He will get almost maximum benefit, like 80% of the heart will be saved. Only 20% of the heart will get affected. But if you go at 12th hour, like 11th or 12th hour, only 10 to 20% of the myocardium, 10 to 20% of the heart only can be saved. 80% it will be permanent damage. You cannot do anything after that. Lifelong we have to suffer because of heart failure. So whenever somebody is developing chest pain or breathing trouble, don't think about coronavirus pandemic outside. It may be there, that is a different issue. Immediately you consult a doctor. Either nowadays online consultations also available through various hospitals. Everybody is providing services. At least one consultation you can take and go to the hospital and do necessary investigations and get treated. Don't ignore chest pain during corona. This is my serious request for all of you. Thank you.